Hey everyone, good afternoon. I wanted to just hop on briefly today to kind of share a little bit of something that was on my heart. Um, February is right around the corner, just a couple days away, and February is known as Heart Month. So, just a campaign to help people become more aware of cardiovascular disease and what a healthy heart can do for you. My kids come home with, the fun fundraisers for the American Heart Association. That's encouraging them to get physically active and great things like that. And I remember doing those same sorts of fundraisers when I was a child and growing up. And I remember always they asked you, who are you fundraising for, or who is it that that's been affected by heart disease. And the list was always really long. Both of my grandfathers passed away from heart-related issues. Um, it's just a very prevalent thing in my family and in a lot of people's families. Almost everybody knows somebody with some sort of heart disease. So that was a huge driving force in me wanting to become a nurse to try to help people and kind of be able to assist people when they weren't feeling their best. And heart disease, unfortunately, is one of those things that comes in on a lot of health histories when you're intaking a patient, and you have to ask them, do you have any sort of heart or kidney diseases? And I would say 9 out of 10 times somebody says, yes, I have high blood pressure or high cholesterol or coronary artery disease, or I've had a heart attack in the past, or I have diabetes or high blood sugars, that sort of thing. So it's a very common, unfortunately, a very common um, chronic disease that we're living with right now. So a couple of things that spoke to me today as I was doing a little bit of research just on the current numbers with cardiovascular disease. And according to the CDC, about one person dies every 36 seconds from some form of cardiovascular disease. Now that can be that's a very broad label. It can be any sort of like heart related things, even strokes are kind of categorized in that. But 655,000 Americans, just Americans, die each year from some form of cardiovascular disease. Now, who knows what COVID is going to bring into those numbers and how that's going to look in the future, but for previously reported years, 655,000 Americans die each year from cardiovascular disease. That's a lot of people. And 1 in 4 deaths are usually um, heart related. So if you think of, as a coach, I talk to people all the time about like, who are your surroundings? Who are the people that you're living with? You take on the habits of the 5 people that you're closest to. Well, 1 in 4 people have a heart related death. So that means that one of those people that you hang out with is likely going to have some sort of cardiac related death at some point in their life or suffer from some form of cardiovascular disease, unless we do something to change that. And so one of the things that I became passionate about as a nurse was to help people. And one of the things that became glaringly apparent in my 10 years of nursing is that it's really hard to help people just at the bedside. Yes, we can put band-aids on people, we can give them medications. There are amazing doctors that perform amazing procedures that are life-saving, um, but we don't get to the heart of things, no pun intended. Very rarely are we able to sit down with the patient and provide them with the resources that they need in order to effectively lower their blood pressure or their blood sugar or even their cholesterol levels without some sort of, medication. And a lot of that starts years before there's a problem in the realm of just preventative medicine. And a lot of that's been lost over the years. We don't take time for ourselves. A lot of us find it difficult to preventatively think about the future. I think even I grew up with the idea that, I'm ingrained to have whatever kind of genetics that I have. And my grandparents died of heart related issues and strokes and that sort of thing. But yet, So that's likely going to happen to me, and I have no control over that. But in reality, there's a lot of things that we have control over. And so some of those like big causes of heart disease and things that we can modify and have control over, just to kind of like briefly overview that, are going to be like things like not smoking. Smoking can be incredibly detrimental and worsen that risk of cardiovascular disease. Not only that, but your lungs too, and completely destroy your lungs, which is not great either. In witnessing people who are end of life from COPD exacerbations and asthma and things like that related to smoking, it's really heartbreaking to see people who are gasping for air at the end of their life because of a life choice like smoking. So, if you're a smoker, you should consider quitting. Other things that we can modify and have control over are going to be cholesterol levels, our blood pressure, and our blood sugars. So some of those things, are all kind of intertwined, and they go along with being overweight or obese, having poor nutrition, living a sedentary lifestyle, not being very active, having lots of excess stress, drinking excess alcohol or just alcohol in general. I mean, these are all sorts of things that I feel like a lot of us wear as like this badge of honor, like, oh, I'm super stressed and I don't eat well, but haha, that's funny. And we find ways to cope and joke about it. But in all honesty, those are the things that are moving us closer to our graves than we want to be, in all honesty. So a couple of things that the American Heart Association has created this little thing called My Life Check. And so what it is it's this list of 7 risk factors that you can change and have some sort of control over in order to help prevent cardiovascular disease in the future. And so some of those, a lot of them I've already mentioned, but basically making sure that you are working with your doctor to have adequate blood pressure management and control of your cholesterol and reducing your blood sugars. Those 3 things can all be affected by becoming active, eating better, losing a little weight, and stop smoking. So everything is all kind of intertwined together, but it all starts with you. You have the ability to change that. And so I want to invite you to make a declaration for the month of February. February is a short month, people, only 28 days. What can you pledge to change for 28 days? Doesn't have to be anything huge and drastic. Just commit to getting a walk in every day, or cutting out some sugar. Maybe you're gonna quit smoking. Maybe you'll look at how many, I don't know, how many minutes of activity you're getting every day. Whatever it is, maybe you want to lose 5 pounds. Whatever you can do to commit, I want you to pledge some form of goal that you can do in the month of February for 28 days. I'm committing to maintaining my 10,000 steps a day and exercising for at least 21 minutes a day. It's 2021. I'm going with 20. I'm going with 21. 30 minutes can seem overwhelming all at once, but with 21 minutes of exercise and 10,000 steps, I'm going to be active for at least 30 minutes, which is great. You don't have to do that, but in addition to that, I'm going to make sure that I drink water, and I'm going to make a conscious effort to cut back on alcohol and to look at my nutrition, not having all those excess carbs. Valentine's Day is in the middle of February, which can be, a nice excuse to binge eat all the chocolate and all of those things. But those sorts of thoughts and mentalities are what lead us down the rabbit hole of poor health in the first place. So if you have any questions about anything that I've talked about in this video, or if you have a pledge that you want to make for the month of February, shoot me a message. I would love to hear it. I'd love to help support and encourage you as you embark on that endeavor. And I have some great resources that I can share with you as well, if that's something that you're committing to. So happy last couple days of January 2021, and here's to a fabulous February.